Is this how you see the world every day? If so, you're not alone. We see dozens of patients just like you every day with refractive surgical problems, from nearsightedness, farsightedness, or astigmatism. We realize you may have some hesitation and have some anxiety when it comes to having refractive surgery, and we understand that. We've been doing this for about 20 years now, and we're confident that we can offer you something that might help your refractive surgical problem. The majority of our patients come to us for LASIK surgery, and this involves making a small protective flap on the front surface of the eye and then applying the laser that's specifically calibrated for their vision needs. The flap is returned into position, the patient goes home and takes eye drops, and by the following morning they're able to drive and return to work. The whole entire procedure takes about 10 minutes, and over 99% of the time patients do very well with this procedure and they're very happy with the results.
Before I had my procedure done, I was literally blind. I couldn't get up in the middle of the night and see 2 feet in front of me. I had to get up and search for my glasses, and when I decided to do LASIK and come see Dr. Volpicelli, everyone here made me feel very comfortable, and he answered all my questions. He was very knowledgeable about everything he told me, explained the procedure to me. When I came in to have it done, it was great. I was very comfortable. I had staff in there helping me. He explained the procedure while we were having it done. One of the staff was even holding my hands and making me feel really comfortable because I was very, very nervous throughout the procedure.
So Jessica put off for several years having LASIK surgery because she was fearful, like the typical patient. After she got up the nerve to come in, we decided to move forward with her procedure. And she was someone who had worn glasses and/or contacts since elementary school. She was very, very nearsighted, could not see even the big E on the chart. And after her procedure, she no longer wears glasses for distance, for driving, for the computer, or for reading vision.
Recovery was great. It was so easy. The next day I got up and I was able to see. I wasn't searching for my glasses, and it's the best decision I've ever made. It's been great.
Although Jessica came in thinking she was a typical patient, there really is no typical patient in that we customize each and every treatment for a particular patient's needs. We take all the necessary measurements, including the topography, the wavefront analysis, and then perform the necessary calculations to determine what they might need for their particular eye condition.
I'm a professional soccer coach, and being able to see clearly is a fundamental part of my ability to coach well. And ever since I've had this procedure, I've been so much happier with the results of just being able to do my job on a regular basis and see my environment more clearly.
So Brian represents a different problem in that he came in originally interested in LASIK, but he was a -13 with approximately 3 diopters of astigmatism. And that means he couldn't see the big E on the chart 4 times the size of that. That's how bad his vision was. So he required a special technique called the ICL, or the intraocular contact lens, and then had a small LASIK procedure afterwards. He's now able to coach both amateur and professional soccer teams, and he's very excited about his results.
It really made a big difference, because at one point I couldn't even tell the difference between players. I couldn't even see the number on their back. And, you know, and some of them, some were Hispanic and some were white and some were Asian, and I couldn't tell who it was. So I'm really happy now. It's finally, I can finally do my job.
And every once in a while we get the opportunity to make a huge difference in a person's life.
Well, I've worn glasses since I was 10 years old. Thick Coke bottle, terrible, horrible glasses. I've always felt self-conscious about them. And when they developed RK, I was so excited. I had RK, and it did okay for me. But by the time they developed it, I was in my 40s. So I still had to wear glasses for reading. Before I came to see Dr. Volpicelli, I had been seeing double for several years from an astigmatism. I had cataracts in both eyes, and they were growing, and I was seeing less and less. I got almost to the point where I couldn't read at all. And for someone like me whose favorite thing is to read, that was really difficult.
So Barb was a more challenging patient in that she previously had radial keratotomy. And that was performed by a surgeon about 25 years ago outside of this area. And she came in with complaints of blurred vision. And initially she wanted LASIK, but we determined that she wasn't a good candidate for LASIK because she was very farsighted and she had some prior scarring on her cornea from the radial keratotomy surgery. Over time she developed cataracts and she decided she was going to have cataract surgery, and after talking to her about what her needs and desires were, we decided that she would do best with a premium channel intraocular lens known as the crystalline lens. And what that lens allows is for one to have surgery that corrects not only their distance vision, but it also corrects their mid-range and their near vision. And again, for someone in her late 50s, no longer needing to wear glasses for distance, mid-range, or near vision, she's a very excited and happy patient, and I'm happy for her.
I think Dr. Volpicelli is a perfectionist, and he did a fantastic job on my eyes. And I'm only about 6 weeks past surgery. I am so excited about it. I can see, I'm not seeing double, I can read, I can watch the TV. I can see my computer at work. The last pair of glasses I got before the surgery cost me over $1,000. So I have 20/20 vision now. I can't wait. I'm just going to go out and explore the world. It's absolutely wonderful. He did a great job for me.
So these are just a few cases that represent a small fraction of what we do here. In addition to LASIK, the ICL, cataract surgery, as well as corneal transplants, we also treat glaucoma and diabetic retinopathy. We also have an optical shop on site for patients' convenience as well. I'd like to invite you to come in for a complimentary consultation or just to take a tour of our office. I also realize you may have some unanswered questions, so feel free to call us. We'd love to hear from you.